I feel like smashing that patient and the physical therapist with a sledgehammer when a patient with facial paralysis comes into the office saying they're using electrical stimulation, chewing, sucking on a straw, or rubbing ice on their face because that will ruin your face in a way that it will never be the same again. In this video, I'm going to talk about 4 things you are absolutely forbidden to do if you have facial paralysis. The first one is applying ice to your face. I want you to ask your physical therapist for even a single reason why ice would help you regain any movement. On the contrary, ice will make your muscles stiff, just like when it's cold, and you'll end up with even less movement than you had before. Even when you regain muscle strength, your face needs to have a wide range of motion and be able to move freely. Ice does not help you regain movement, but after you recover, the muscle becomes so contracted that you can't relax it. You've probably seen some patients on the internet with facial rigidity. So, for the face, we don't use ice, we use a warm compress that actually relaxes the muscles and allows for a greater range of movement. Item number 2 that you are forbidden to do during facial paralysis is making mouth movements to chew, bite, or suck through a straw. Understand this, chewing movements come from the trigeminal nerve, not the facial nerve. And our brain is extremely intelligent. If you practice closing your mouth, opening your mouth, sucking through a straw, and moving your face, your brain will learn that. And then when you sit at the table with a lot of people, what will happen when you start to eat? That's right, your face will start to move. And then unlearning something so complex becomes very difficult. Therefore, movements like chewing gum, blowing up balloons, or sucking through a straw to increase facial movement should not be done. Facial movements should only happen when facial movement is actually needed, not when you are eating, okay? Third extremely important point, don't make faces. Don't get into the habit of looking in the mirror and making facial movements that shouldn't exist because the brain is extremely intelligent. If you show your brain that it should make these facial expressions, it will learn to move the muscles that way, and then you'll develop synkinesis, which is when movements happen in both your mouth and eye at the same time, the eye and the forehead at the same time. And then, synkinesis causes uncoordinated movements that overstimulate the muscle, and you can't unlearn this. And it also ends up causing stiffness, because the muscle that moves and is repeatedly used eventually becomes rigid over time. Therefore, making faces is not recommended at all. And finally, don't just wait around after a severe paralysis. If you had tumor surgery, if you had brain surgery, if you suffered a fracture, and you notice that your face isn't improving, don't keep doing physical therapy for 1 or 2 years, only to find out later that the window for reinnervation surgery has already passed. If your face is showing very little improvement, time is passing, 3 to 6 months have already gone by, and you still can't close your eye, your face still pulls to the side that wasn't paralyzed. Pay attention, don't just wait. Reinnervation surgery yields the best results the earlier it is performed. If you enjoyed this video and noticed that there is very little content on the internet about facial paralysis that truly helps you recover from this problem, I would like to ask for your help as well by liking this video and following our channel.